Fundamental electrolytes. You're going to go to page 79 in your book. Page 79 in your book. Okay, page 79. Okay. Electrolytes is learned in fundamental. That is the first thing you should have learned in nursing school. In fundamental. Mommy, there's chairs over somewhere. There's chairs over here. Instead of you guys sitting there. There's chairs on this side and this chair. Look at this chair. Right? You don't have to sit next to each other. I know. Right here. And right here, Mommy, then you live wrong. Okay? Okay. So, welcome to electrolytes. Miss Sonia wants you to know, ready? Let me go on the board. Nothing more. Low potassium, high potassium, low, right? Sodium, high sodium, low calcium, high calcium. Any question? Those are the four you need to know. Deal? Everybody say deal.
Deal.
Are you going to read more than that?
No.
Okay. Now, NCLEX asks you a lot of electrolytes questions. Right? Now, let's go. You're going to go page 79. Yellow book, purple book. You don't have this. It's all over the place. Yellow book, purple book, I need you to get with a pen. And I need you to make a copy of the book. Okay? Please, I need you to purchase the book. Promise? Promise. Go buy it. It's very cheap on Amazon. Right? I think it's 40.
Less than that.
It depends on when you get it. Okay? All right. So please, let's go to page 79. Okay? Now, before we go to page 79, let's go look box 9-3. Box 9-3. Everybody with me, right? Now, on the top, you should see cause. True? On the bottom, you see sign and symptoms. True? And on the green box, you see the value and the food. Right? Yeah. That's the way you're going to study. Right? What caused potassium low? But Miss Sonia, why do they say low potassium, high potassium? Why is this important? Why is all of this? Guys, electrolytes is important because electrolytes help the body to function, right? Now, let me explain to you. How will I know your potassium is low or high? Because I took blood work. Blood work. Now, Mr. Potassium, right? Mr. Potassium helps with muscle, contractility of the muscles. We have muscles in our face. We have muscles, right? Respiratory, our heart. We have muscles in our legs. We have muscles everywhere, right? Now, since potassium helps with muscles, if your potassium is low or high, right? Low or high, the patient can have heart problem. Any question? So let's see what will cause someone to have low potassium. Something I taught you yesterday. What was it? Insulin. So let's go. See if what I told you yesterday was truthful. Right? Ready? What causes potassium to be low? Diuretics, like what? Lasix, diarrhea, vomiting, inadequate intake of potassium, excessive gastric suctioning, which is an NG2, right? Cause your potassium to go low. Excessive fistula drainage, like a big wound, when you do wound vac, cause potassium to go low. Chronic use of steroids, all the steroids and with zone, right, can affect your potassium. Renal disease. Did I say renal failure?
No.
I said renal disease. Can I ask you a question? When I'm in renal failure, how do we try to fix that renal failure? Dialysis. So let me tell you what NCLEX say. Patient is on dialysis. Which electrolyte is compromised? Potassium. Anytime you on dialysis, your potassium is always high. High. Renal disease. Potassium is low. Renal failure. Potassium is high. It is understood. Anytime you do dialysis, the doctor order Kexolate. Renal disease is nephrotic syndrome. Renal disease, acute glomerulonephritis. That is a disease of the kidney. Renal failure says the kidney is no good. Kidney no good at all. Potassium is high. Renal disease, potassium is low. You got it? Okay. Continuing. TPN. TPN. Burn patient. TPN. I didn't say that too much. TPN. I said TPN. Potassium is low. Uncontrolled diabetes. Yesterday. Remember? Uncontrolled diabetes. That means, look. I give you insulin. Insulin has two jobs. I'm going to take your sugar, and I'm also going to take what? Okay, so let me ask you a question. Is diabetic patient potassium low, or is it diabetic patient when you get insulin, your potassium low? When you get insulin. So diabetic patient, your potassium is okay. Is when we give you the insulin, potassium is. Any question? Okay, so sign and symptom of low potassium. So Carol, who potassium is low in the blood, this is what I will see in Carol. Ready? Leg cramps, you agree. Lethargy, weakness, you agree. Shallow respiration, you agree. Confusion, you agree. Decreased absent reflexes, you agree. Now, PP wave. Where did I teach you that? EKG. So here's NCLEX. They give you 4 EKGs, and they say, what do you do for the patient? You say, call doctor, and it's a big choice. Give potassium. When potassium is low, the EKG strip looks like this. Ready?
Big.
Ready? Go. Tall P. Tall P. Right? Ready? Q, R, S, and flat T. Right? Flat T. I will give you EKG in the palm of your hand. Don't bother me. You're going to be an EKG queen or king when you finish it. So tall P, right? Flat T. This is a normal EKG. Right? B, Q, R, S, T. This is a normal, and it has boxes divided. A P, a Q, a R, a S, and a T. Look at P mean wall. That it be out. Look at the P. It's tall, like a Christmas tree. It's supposed to be like this, not tall. Okay? Don't worry, I'll give you strip and cardio. You know, my bowel be nice. Any question? So NCLEX give you this, and they say, What do you do? A, call doctor. Student, you call doctor. B, give potassium. C, give the digoxin. Wrong. The answer is B. Oh, and you said, what? They gave me EKG. Well, honey, they gave you an EKG of low potassium. And guys, students say, well, Miss Sonia, don't you have to call the doctor? It is understood when you an RN. The people know you got to call the doctor. But they want to know, do you know how a strip look? Any question? And guys, Miss Sonia say, NCLEX say, anytime you see, call the doctor. I want you to go to the choices. I want you to see, is there anything else as the nurse I can do? You can give potassium. Anytime you see something in the choices that you can do, call the doctor, not the answer. Call the doctor, boom. Don't call the doctor ever. How's that? They want to know what you going to do. Don't get it. The people know what the doctor can do. They want to know, do you know what to do? Don't get called the doctor. Please listen. Anytime I want you to call the doctor, in the choices, I'm going to put some more stuff. The patient didn't do this. The patient turned blue. The patient fingers fell off. I'm going to give you some deep stuff. Then you call the doctor. Meaning it's out of your control. But guys, if I call the doctor, give potassium, whoa, you know the answer is give potassium because that is something RN can do. Yes. Okay, now call the doctor. Let me tell you what she said. The patient was normal at 8 o'clock. And they gave you a nice respiration at 10 o'clock. Then now it's forced stuff going down. Of course. Because you're going from positive to negative. That's understood. Don't nobody got to teach you that. That means the patient going bad to worse. You were working. You lost your job, so you had money in the bank. You stopped working, so you had to use the money. Now there's no money no more. What are your options? Go work some more. You see, it's the same thing. Bagay tebo, kunya bagay mala. That is understood. Yes. Sometimes. It can say give potassium as ordered. Sometimes, not all the time.
That'd be good.
Yeah, that's good. But I want you to know too, if they don't put it, it's good too. You see that? These are the critical thinking questions. Why students say, oh, I studied. Oh, Miss Sonia, I studied. I promise you I studied. And they do study, but you still going to fail because of that critical thinking that I'm trying to pull out of you. You got to bring it, guys. Bring it. All right?
Oh, Sonia.
Yes.
You say that if the doctor don't tell you to give the potassium, and when you're taking you up to give the potassium, you don't call the doctor and let them know you're going to go.
No, Shelly. No. If they give you an EKG like this, and they ask you, what is your initial? Why? Initial. Right when you see that, you see, that's something wrong. Flat T, yeah, I can call the doctor. But something else I can do because initial is a priority. And I told you, anytime you see initial, first, best, all of the answers are good. A is good, B is good, C is good, D. But you're looking for the best. calling the doctor will do what for the patient with this
Right now.
EKG?
Nothing.
Nothing. Nothing. You see, the patient have this, guys. This. What's priority? Call doctor. My question to you, what will that do for the patient right now? Nothing. That's how I want you to think. Yesterday, in test-taking strategy, we had a question. The patient had emphysema. The family came to see the patient. The family took the oxygen and increased it high. What is the initial nursing intervention? Watch. And this one is a pretty one. The choices were this. Bring it back to 2 liters.
Explain to them why.
Explain to the family
Then bring it back.
why.
Then
And then bring back. Nous changer ça.
Yeah.
3, I think it was one tell the family to leave.
No, only the nurse has to.
Yeah, one say only the nurse,
Has to.
something, and the other one is call supervisor. Something, it didn't make sense. Huh? Keep it the same. Yes. Now.
No, I say bring it back to 5 liters.
Bring it, well, bring it back. Whatever. Bring back. Bring back to 5 liters. Okay, look. Shh. The patient had emphysema. What I noticed, the students didn't know what was emphysema, and that scared me.
I know.
Because I had to say, I didn't put COPD on the scenario. It was emphysema. So you must know that emphysema and bronchitis equal to what? Okay. So if I was you, I would have changed it to COPD. Now, look, choice, bring it back to 2 liters. Explain family and bring it back to 2 liters. Now, let's take out what's no good. I want you to think what's going to help the patient now. Let's go. So, we said, let's take out the ones no good. True?
Yeah.
We're going to take D out.
Yeah.
True? Everybody agree?
Yes.
Okay. Now, what was this? Only the nerve. We're going to only, that's a hot word. We're going to take that out. We left with A and B. So now you're nervous. They say, which one is priority? What did Miss Sonia tell you about priority? All of them is good, but you looking for the best. So, now, on NCLEX, as you get a question like that, you say, COPD, I learned it, med-surg respiratory. You sit tight, med-surg respiratory. So your little board, you put A, true? You comfortable. Okay, now, COPD, I know the oxygen cannot be more than 2 liters. Oh, but the family put it up. Okay, so I don't want to be mean to the family, but I got to look at the patient. So do I explain and then bring it down? No. Or do I bring it down and explain later? Bring it down and then explain later because I need to focus on the patient. Any questions? Can y'all think like that? Yes. You promise me you're going to think like that. Yes. Now listen. Listen, is this wrong? No. It's not wrong. But what's the key? The patient.
The priority.
See, the kid do something and you explain later, or you explain then What's the best parenting? Explain first, and then you say, and you tell them, you say, the reason I spank you is because I want you to know that it's not good. Yes. Yes. You got it? This is why students fail. Not because you don't read. I like to mess with you guys. But guys, honestly, my heart of heart, everybody will go read something. The problem is you don't get that critical thinking. And some people don't understand at all. Oh, who does that? Martin. Anyways, we cool?
Yeah.
Okay, now, if your potassium is low, well, what numbers do we have? 3.5 to 5.1. Listen, you don't go call no doctor no 5.2 after he cussed you out and put some seasoning on you. No, look guys, 3.4, you call doctor emergency. No, only 1 point? Come on, 5.5, 5.4, right? You call doctor, but God there, 1 point, 3.4. Students say, wait, call doctor. No. You see it? So know your labs. Food that have potassium. And let me tell you what NCLEX say. They do this. Which food has the highest?
Potato.
No, the what? We jumped. Right? So look, watch. Let's go. Let me show you. Avocado, banana, cantaloupes, carrots, everything in alphabetical order. Fish, mushroom, oranges, potatoes, pork, beef, and veal, raisins, spinach, strawberries, tomatoes. They don't give it to you like that. They say V8 juice.
Oh, yeah, he has tomato in it. Yeah.
Campbell, tomato soup. The food on the tilapia. What is tilapia? Fish. Tuna. What is tuna? That's how they get it. A banana sundae. Banana split. They don't give it to you. And the students, you go memorizing banana, cantaloupe, carrot, and they give you something. Watch. You see the raisins? They don't put raisins. They put dried fruits. So see, oh Lord, you're in trouble. Guys, they don't give you this here. No, but if I tell you dates, or if I give you apricots, isn't that the same as dried fruit? Raisins, dried fruit. Anglais is still the same thing. It's about comprendre, right? Comprendre. So make sure you know that. And they say strawberry shortcake. You see, strawberry shortcake is a cake. Okay? Banana split. Okay? And the reason, because my PN student, that's how I give you my test. I don't give stuff like this so easy. I put V8, that V8 juice, they always get you on the place. V8 juice made you up. What other English food in your Bible say V8 juice is tomato. You got it? So NCLEX is about what? Understanding. True? We learned that now? Yes. That's why everybody can't be no nurse. Now you get mad, I'm going to stick to it. Let's go to high potassium. Renal failure. I don't have to put renal failure. I'm going to give you a BUN and creatinine. What is a normal creatinine? Normal. 0.001. So that's a penny. If I gave you this, how much I gave you? 1 cent. If I gave you this, how much I gave you?
$1.
Okay. And so creatinine, you want small numbers. Anytime you see 1, 2, 3, why? Medical emergency. Kidney no good. So look, I don't have to put renal failure. I don't have to. I'm going to give you the lab value. Or I'll say the patient is on dialysis. Renal failure gets what? Dialysis. The patient have nephrotic syndrome. What is nephrotic syndrome? Renal disease that kids get. So renal disease, your potassium is what? Low. Renal failure, your potassium is high. You see it? Any question? So I can give you anything I want. You got it? Now, intestinal obstruction. What disease I taught you intestinal obstruction? 2 GI disease. Come on. IBS. Crohn's disease. Ulcerative colitis. Potassium is high. Now let me explain to you with ulcerative colitis. Because remember you have diarrhea, bloody diarrhea. The disease in itself makes your potassium is high. But when you start crapping all over diarrhea, you see the potassium. So I want y'all to understand that. Okay? Continuing. Cell damage. Anytime you have cancer and you get chemo, your potassium is high. Chemo sometimes puts the patient in heart failure. We got one, cell damage. Yes. No. Okay, explain to me how. Yeah, but I will have to tell you the cell in the pancreas that is bad. You understand? Let me explain what she's saying. Sometimes you have diabetes type 1, and they say the cell in the pancreas is broken. If I want you to think that way, I'm going to put it. And there's a name for that cell, I can't remember, in the pancreas. I will say it. But anytime you hear cell damage, a lot of times it's cancer, endometrioplasm. No. Potassium in diabetic patients is always normal. Is when we give you the insulin, the potassium. Okay? Okay, metabolic acidosis. Now, you remember we did ABGs. What disease fall under metabolic acidosis? Respiratory. No, metabolic acidosis. Starvation. Hypoxia is not metabolic acidosis. Hypoxia is respiratory alkalosis. Anytime we talk about hypoxia, we're talking about respiratory. Hypoxia is lack of oxygen. Metabolic, starvation, high fat diet. Vomiting is metabolic what? Acidosis. We talk about metabolic acidosis, diarrhea, anorexia, okay, malnutrition. Okay, new student, you don't know. Old student, we mixing. We got problems. We need to know what falls under metabolic and what falls under respiratory. Big on NCLEX, all right? Let's continue. Excessive intake of potassium. Anytime, RN. Anytime you hang in blood. Miss Sonia said how long the patient has to, how long the nurse has to hang the blood.
4 hours.
4 hours. 15 minutes. 30 minutes.
30 minutes.
30 minutes? I'ma hang you 15 minutes. When the blood comes from the lab, the nurse got 15 minutes to hang the blood, or the blood start to lyse. Lyse means break apart. If you hang that blood that was sitting there more than 15 minutes, not because all blood is kept in a refrigerator type of thing in the blood bank. If you hang this blood that is lyse, lyse means sans fun, right where sun gets bull. This patient can die of heart failure because of the potassium is so high. Now, the 4 hours, listen to me guys. When you are hanging the blood, actual hanging, you can run the blood. You got 4 hours for it to run. for example, if she had blood before, I'm going to do 200, 1 hour. Suppose the doctor order 1 unit of blood. Each unit of her blood coming 400. So 400, if she had blood before, I'm going to do 200 1 hour, 200 the next hour. So that means I ran this blood in 2 hours. If she never had blood, I'm going to do 100, 100, 100, 100. The blood has to be gone within 4 hours. That's what that means. But they say, how long does the blood has to come from the blood bank, and you must run it? 15 minutes. RN, come on. Oh, I'm scared. Yes. There ain't no damn level 3 question. That's a level 1. Level 1, RN. All school taught that. I don't care if you came backward. All school taught RN. Blood hanging from the blood bank to the patient who get transmitted, or the blood start lysing. Bull, little lumps. They call it lice. See, bull, and you can see it. Right, guys, when you look at the blood, you see its pieces. If you hang this blood, oh my God, you see the patient say, I can't do it. I can't do it. Heart racing. That is a medical emergency. That is why on the floor that they have a lot of sickle cell patients, a lot of hemophilia patients, all of them is on heart monitor. Because you hanging blood back that. We don't want these patients, a nurse that will put the blood on time and the patient go into heart problem. All right? That will make your potassium high. You got it? Yes. You don't take it from the refrigerator. Blood bank. Right away. No, you get the blood from the blood bank. You come to the floor. Remember, you run in normal saline. Right away, after you do your check with the nurse, you hang. Whatever you gotta do, you block everything, you go hang. The blood gotta be running. It could be running for 4 hours. But it needs, from the time you took it from the refrigerator to the floor, we get 10 minutes. The refrigerator is set a certain temperature. It's not frozen. It's a certain temperature.
Sonia,
yes.
If you see the blood is coming.
Oh, if it's full, you go give it to them back. If what she said, if the blood come lumpy, you send it back to the blood bank. Yeah, if it come light. Just like when you hang in TPN. TPN, you know you have the lipids, it's grease. You shake it, it's supposed to turn all white. If you see it, it's still cloudy, look crazy, set it back. You cannot hang it. All right? Okay, any question? Make sure. Signs of symptoms: high potassium, muscle weakness, paresthesis, hypotension, diarrhea. Here is the EKG of somebody with high potassium. Look, it's the opposite. If low potassium, PP, high potassium, P is what? Flat. So we're going to do, and this here, I didn't put U wave, sorry. There's a U wave. So this is, look guys, ready? Flat P, QRST, tall T. And don't worry, I'm going to give you EKG nice. I do each EKG. I do sinus braiding, sinus talking, nursing intervention, AFib, nursing nice. You go nice. Okay? It takes me about an hour to do it. An hour, sometimes 2, depends on what morning you guys are having. Right? Any question? And listen. Now, Miss Saunders, why you only want me to know potassium high in water? Because if you know potassium, you know magnesium. Please keep it simple. Keep it simple, right? Keep it simple. No, because if potassium is high, keep it simple. And I'll explain to you how salt and potassium works, right? Because one moves in the cell, one moves out, right? Some anatomy. Okay, any question with potassium? So RN, is potassium a medical emergency? High or?
Oh, yes.
Yes.
I was going to ask, if the patient has high potassium and you're about to give a bag of blood, would you call the doctor to hold it?
Okay, first of all, blood. If the patient have high potassium, yes, you will call the doctor to hold it. But NCLEX, something I forgot to tell you. What do I give when potassium is high? I give a drug called Kayexalate. How you know the Kayexalate is working? Because the patient had diarrhea, stinking diarrhea, and okay? So, yes, so if potassium is high, you will give Kayexalate. Now, some students say you can give Lasix too. Be careful. If you have potassium problem, right? That means potassium high, and I give you Lasix, right? Which I can. The reason that's not a good choice of drug, because the crime doesn't fit the punishment at the time, is because now I give you the Lasix. I got to work on your kidney too now. Kayexalate, when you give it, you only got to focus on the potassium. If I give Lasix to lower the potassium, it will lower the potassium. Now I got to worry about measuring INO2 because of the Lasix. Lasix lower potassium. Kayexalate lower potassium. But anytime a patient has a potassium problem, the drug of choice is Kayexalate. Yes. And they have to be on heart monitor. Yes.
If you feel like potassium, like, you can have
Wait a minute. You gave me two numbers. Yeah. Give me the number again. One, because you gave me two numbers. Okay, if you find a 5.0 before you call the doctor, tell the patient to go drink some orange juice, because 5.0 is 1 point. And anytime the patient is a 5.0, the doctor will not order potassium. They'll tell you, go drink some orange juice, go drink some tomato juice, drink a bean. Yes. Okay. Oh, you said 5.0? Oh, I didn't even think. I thought you said 5. It's normal. Sorry, I didn't hear that. I think what she want to ask if it's 1 point off. True? If it's like 5.2, 1 point off. Okay, by potassium. Give the patient orange. 1 point. I'm sorry, I didn't get that. Okay? Any question? Now, let's go to sodium. Sodium. Right? Now, you see how I'm doing this class. What cause? Sign and symptom. Guys, what caused it? What caused the lady to have low salt? What sign and symptom of low salt? The problem with the students, you know what caused, but you don't know sign and symptom. Okay? So let's go. What caused me to be hypernitremia? Inadequate sodium intake, nothing by mouth. Anytime you're an NPO patient, you have risk for salt issue. GI suction, NG2. Excessive intake of water, yes. When we do endocrine, we're going to do a disease called SIADH, right? SIADH is what happened is the kidney, on top of the kidney, it is spitting a lot of ADH. So therefore, that's why your ADH it's spitting a lot of ADH and your salt is low because of this. While the kidney is spitting out this ADH, water is taking over the body. So water is taking over the body and the water washes out the salt. So that is why you hyponatremia and hypertension, because all of the water is invading the body, but while the water invading the body, selanin is being washed away. And we will learn that in endocrine, SIADH. Hyponatremia and hypertension. Okay? So, continuing. Potent diuretics, Lasix and Bumex. Which one is the strongest? Bumex. Bumex, a lot of insurance don't give it, they don't cover it because it's so expensive. What they do cover is Lasix. Okay? Increased respiration, draining. Anytime a patient has a wound vac, your salt is what? Low. Make sure you know that. Diabetic Ketoacidosis, and they go to SIADH, syndrome of inappropriate antidiuretic hormone. Now, retention with kidney or heart failure. Anytime the patient is left heart failure, right heart failure, or kidney failure, the salt is low. Why? Because they are what? Retaining fluid. Okay? Signs and symptoms that I have low salt. My pulse is thready. Postural blood pressure changes. Weakness, stomach cramping, poor skin turgor, muscle twitching, and seizures. Apprehension. Listen, so NCLEX asks you, watch this. The patient has a sodium level, and the normal sodium is 135 to 145. A sodium level of 125. Watch. I'm going to go to the board. I ask you, what's priority? A, watch. C, D. Suction the patient. Remove all rugs. Take vitals. One more. Weigh the patient. Sodium 125. Think and don't think. The patient's sodium is low. Normal sodium is 135, 145. What is priority? Check the vital sign. That what y'all do? There we go. Vital. No. The patient B. Right? My daughter does that. She's 14. She do crazy stuff like that. Right? Okay, look, I'm going to get you. The patient's sodium is 125. It's low. What is priority? Wait a minute. Tell me, who chose suctioning? No. Good job. Who did remove our rub? Everybody. Who take vitals?
The priority.
You, my lady, will take vitals. See, wait a patient.
No,
Wait a patient.
not priority.
Hallelujah. First of all, let's go. Yes, ma'am.
No, because I was thinking, the question is saying if the patient is restless.
Yeah.
I was thinking restless, high, low potassium, sodium, she's retaining liquids, she has an emergency to go to the bathroom, so I would remove the rocks, but I don't know how to
Okay, so let me help you. First of all, why? First of all, sodium is 125. I learned that in fundamental electrolyte. I want you to use the skills I taught you. Because sodium is 125, that means assessment was done. Take this out. Yes. Miss Sonia say, when your sodium is low, yes, you return fluid. Yes, your vitals, but assessment was done, so the answer is not vitals. Now, Maslow say airway safety because low sodium cause seizures. Priority is air.
Suctioning?
Well, look in the book. Seizure.
Oh, I would take suctioning.
I know you will never, because nobody critical thing. But I heard somebody say, shh, be quiet, be quiet. Shh. I heard somebody say safety. You right. You right. But it's not priority here. Because Maslow say airway first and then safety. Reading the book, it tells you the patient with low sodium at risk for seizures.
Oh, yeah.
Yes. Millie, this is where you guys function. Maybe not. And mommy, your safety, you ain't wrong. I feel you.
So this airway.
But
Right here.
I thought suction was hypernitremia, so why you have to suction again?
Because anytime a patient have 125 of sodium of 125, the patient automatically go into seizures. Priority of seizures is airway, baby. Suctioning again. Yes, yes, suctioning NG2 cause low sodium. I got that. But the patient respiration is compromised.
That's the first thing I would have taken out.
No, mama, I got this so deep on my mama, papa, you run.
In this scenario,
I know you, and you know what? I said here, seizures. Seizure. I said seizure. Anytime you see my sodium is high or low, you better initiate seizure precaution. So let's initiate seizure precaution. Padded side rails and boo bag, suctioning. Come on, let's initiate seizure precaution. Isn't that what the school taught you? Let's initiate seizure precaution. Padded side rails. Put the patient on the floor. Remove the code. Protect the head. Have suctioning at the bedside.
That's the first thing I took out.
I need you guys to critical think. It's right in the book. Yes. Hurry up, because we got to keep on moving.
That low sodium, really only the trick person?
Mommy, no. This patient will be seizure precaution. We need to be watching the patient. If guys, you'll see the patient twitching like this. Ooh, that seizure coming, baby. Oxygen, you better have, and you go safety. Somebody say safety. God, this patient gonna be so weak, they ain't gonna get up. So where you gonna go with your safety? That patient already safe, because that patient gonna say, ooh, I'm too weak, I can't even get up.
Miss Sonia, but in this scenario,
Yes, ma'am.
If in this scenario they put airway and seizure, so which one you will take?
They
Never.
will never put that.
The crime don't meet the punishment, because both is good. Yes. That's what I said. That's what I said. If salt is low or high, always initiate. Okay, let me tell you with high. Anytime somebody has high salt, so your blood pressure is high, right? Anytime your blood pressure is 200/100, you start stroking out. What's priority with stroke? What's priority with stroke? Seizure. Whoa, mommy, please don't say that. Vanette, you did not say that. We gonna take that license away. Please don't say that. That it's only for home. This is a question on electrolyte. As a nurse, you must know what to do. Period. You cannot say this question for home versus electrolyte is electrolyte, whether you PN or RN. Guys, it's in the book. La book. All right. Yes.
Yeah, that's just a patient on lithium and lithium.
Talk to me. Listen to what she said.
And when you on lithium, you progress secretion. That's why it is supposed to suction you.
No. When you are on lithium, lithium causes seizures. That's why they give patient lithium tetraprotol. They give patient who on lithium valproic acid. Anytime you on lithium, we must initiate seizure precaution.
Any question?
You must think. We're not thinking. We're making excuses. No. Did y'all have time to give me seizure precaution? Initiate. Isn't suction one of the seizure precaution? Initiate seizure precaution. And boo bag, trach, suctioning. Isn't that part of it? That's what they taught me at Nova. Yeah. Okay. Let's continue. All right. Then we go into high sodium, hypernitremia, decreased water intake, right? Fever, dehydration, hyperventilating. Now stop. Where did I teach you in ABGs? Was it respiratory alkalosis or respiratory acidosis? Alkalosis. Remember? Early asthma. You late asthma. You oh. So early asthma, which is good, you hyperventilating, you are respiratory alkalosis. True? Make sure we know that. Watery diarrhea, which is C. diff. Guys, let me tell you something. Anytime you have infection, not only your fever, your WBC high, but your salt is high. Don't ever forget that. So when NCLEX asks you, give you a WBC that's elevated, they ask you which electrolyte is compromised. Sodium, very high. People with fever also have high sodium. Don't forget that, okay? Don't forget that. Now, let me ask you a question. I'm burnt. Ule, burnt. Keep it simple. Keep it simple. How's my sodium? Low.
No.
Hallelujah. Why don't you think it out? Low, high. Think it through. Use your book. Sodium, burnt patient, your sodium is low. But let's understand why. Because students go to memorize. No more memorizing. I shall understand. That's our model. Why? Think about it. I'm burnt. I'm retaining fluid. So what's going out is low. What happened to the potassium? It shifted, so potassium is high and sodium is low. Any question? Now, so a burnt patient will have what on them? Cardiac, because they will have hyperkalemia and hyponatremia. We got it? No, maybe. Renal failure. Oh, let's go here. I was the wrong one. Diabetic insipidus, right? Hypernitremia. Diabetic insipidus has to do with low ADH. SIADH is high ADH. So you remember that yesterday I put diabetic mellitus on the board? And I also put diabetic insipidus. Remember I told you, diabetic insipidus is when the ADH is low. So when ADH is low, you're diabetic insipidus. When ADH is high, you SIADH. So SIADH, your sodium is low. Diabetic insipidus, your sodium is high. This is where you PP white, you PP, you polyuria, and it's white, 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 white. Any question? Make sure we know that. Okay? Now, excessive administration of sodium bicarbonate. Yes. Let me ask you a question. If you need salt, we don't go tell Kawan, go eat you some salt. Never. Whatever Kawan eat, Kawan continue to eat. The doctor is allowed to order you salt tabs. Okay? You never tell the patient, go eat more salt. Even if I'm lithium, remember? I'm on lithium. You never tell the patient, eat more salt or cut back on your salt. It's the doctor's job. Okay? Whatever you was eating, continue to eat. Okay? And that's when patients have salt issues. Any question? Now, signs and symptoms when your salt is high. Dry mucous membrane, loss of skin turgor, thirst, flushed skin, you see the elevated temperature. Oliguria, PPPT, be small, right? Muscle twitching, fatigue, confusion, seizures. So here you go. When your sodium is low, what's priority? Airway. When your sodium is high, what's priority? Airway. Because when my sodium is low, I'm at risk for seizures. When my sodium is high, I'm at risk for stroke that cause seizure. Oh, God. You got it, guys? Understand. Any question? Okay? Now, this is where you guys gonna flip out. Regular sodium, Miss Sonia told you 135 to 145. And guys, let me tell you, when you see seizure, not 130. For me to see this lady having a seizure, 120, 115, 110, more. Not the lady, look, 135, 134. You will never see seizures. Never. Seizure, 125, 116, 120. No, honestly, 150. You see problems because of a stroke. Yes. Seizure, hey, right here, mom. Right here. This mom. Okay. 2 grams sodium minimum. Here, take this and add a little salt. That is the norm for people. Because you see, if we put you on a low sodium diet and you don't eat salt, then seizures. Any question? Okay, here's the food. Students, you're going to say, ooh, I didn't know that. Bacon, you'll get it on NCLEX. Butter, you'll get it on NCLEX. Canned food, listen, they don't give canned food no more because they know other students know that. Okay? Cheese, white, You know what cheese they talk about? Cheese jaune, fromage. Yes. Yellow cheese. Hot dogs. Everybody will get that. Ketchup. Lunch meat. Yes. Lunch meat is where you go to Publix, the deli. Okay? Milk. This is what I need you to do for me tonight. Right? I want you to go home tonight, not 10 o'clock. And I want you to drink a cold glass of milk. 2%, 1%, whatever percent you want. Drink it, and then I want you to call me in the morning. Text me. You're going to have a headache so deep. Cold milk causes high salt. Not only milk, high in salt, it also rip away your iron, make you anemic. That's why when kids leave Baba formula or they leave breast milk, mommy start them on gyro milk. You must give them iron. Iron, milk is good for you, source of calcium. I got that. However, it does strip your iron away, make you very anemic, very high in salt. So Haitian people, this is what we do. We boil it, and then we put the salt on it. Wrong. Look, when you boil it, that is called evaporation. True. It removes the salt. But instead of you go putting cinnamon and keep it moving, you put a little salt and sugar. So, right, and you get the headache. Milk helps with sleeping. Milk, turkey meat help because they all have melatonin in them. So they make you sleep. That's why when a patient cannot sleep, you go give them a cup of milk, you boil it, and you give it to them because it'll help them sleep. Cold milk don't help you sleep. Warm milk will help you sleep. All right? So know that. Mustard, right? Mustard, ketchup, dressing. That's why the students, I'm on a diet. And they have a nice salad. Then they pull out the dressing. That's the salt. Ready? Processed food. Processed food is mangé dans sac fouet to the freezer food and you put it in the microwave. NCLEX don't ask those because you know. What NCLEX do ask, a lot of snack. All Dunkin' Donuts, all Krispy Kreme, Honey Bun, Twinkies, all of that high in salt. Snack, good food, cake, right? High in salt. Make sure you know that. Here it is. Soy sauce, you get that. Table salt, here it is. Wheat bread, nobody knew that. Listen, the doctor wants you to lose weight, so they'll tell you eat a lot of wheat and fiber. Why? Because it makes you feel full. That is for cholesterol. I got that. But if you have hypertension, white bread and wheat bread is not the bread for you. Because wheat bread, white bread has high salt. And I get you on my mama and papa. Because I put the patient is on beta blocker. Which food you give them? You know how many of you guys get the turkey on wheat? It's high in salt, and you get it wrong, and you get mad. But it's wheat bread. Because culturally we say brown is good. Brown is good for cholesterol because it makes you feel full, so therefore you don't go continue to eat. But if you got a salt problem, wheat is bad. Deal? Corn. Oh, boil of corn. Salty. How do we eat corn? We buy it and then we grill it. That's the way you eat corn. Anytime you put corn in a microwave, it's full of salt. Oil. Walmart. Full of salt. Now, carrots. Raw carrots. Full of salt. Celery. Full of salt. Make sure you know that. Those are NCLEX questions. So students say, well, carrots are good for you. Not if you have problem with blood pressure. Etc. Raw carrots. Milk, yes, they throw milk. Milk highly in salt, highly in fat. Milk, white milk. That the worst. The red top. Any question? Please, guys, know this. And I'm going to get your question, Mommy. Hold on. Stay away from the norm. Them people is NCLEX, Pearson. The state of Florida, hell, they know you know processed food has salt. They know you know canned food. Them people not going to give you that hint. So they're going to ask you, the food, what will you put in the food so it can taste good? Lemon juice. Curry. Jamaican student, they'll tell you. When they make curry chicken, the curry doesn't have salt in it. They put the curry, is the season, it's the curry, but then they add that other seasoning. Curry is good. Bagay sauce bon. How do you call it Creole? It's a sauce. Good. Paprika. Good. Yes, you make it herbs, tea-fay. Because you want to make the food smell good so people can eat it, but when they taste it, lemon juice is where to go. Mrs. Dash. Vinegar. Be careful with that vinegar. Mrs. Dash got a... No, you can put Mrs. Dash. You can put Mrs. Dash. Lemon juice. What about wash? Give me stuff to wash my mouth. No, let me brush my teeth before I eat. Would that help the food to taste better? Onions. Yes, guys, people eat something when it look good, when it smell good, although it ain't good. Kids, how do we trick kids to take antibiotic? They go to Walgreens.
Flavor it.
They flavor it, baby. What you want? Strawberry, peach. And when they taste it, they, but I smell peach. Bubble gum. Right? You trick people. Like when you go do a CT scan and they want you to ingest that dye, it tastes like metal, but it smells so good. Which flavor you want, ma'am? You want gray. By the time you put it in your mouth, it tastes like metal. You see that? So people eat when it smells good, when it looks good. And really it's not. Any question? Right? Yes, ma'am. We cool? Somebody had a question. Yes, ma'am. High in sodium. Raw celery. Raw celery, raw carrots. Right? Raw celery. Anybody ever get quick weight loss? But anyway, you do quick weight loss. They give you a list of stuff you don't eat. And I'm telling you, carrots, you don't eat raw carrots. You don't eat tomatoes. Very high in salt. Salt causes you to retain what? Yep. Any question? You see how electrolytes important? So guys, listen. If the patient comes to me and says, doctor, I'm weak, I don't know what I'm weak. The first thing they will do is blood test. Listen, for me to say, Carol, you have this disease, I need two things from Carol. Blood test, some. So a lot of Asian people, my mom, she always said, oh, the people want money. They do all these blood like vampires. They do it to diagnose you. We need blood tests, and we need machine tests, and then we say, this is the disease we have. Okay? So electrolytes is important. That's why we teach it in fundamental at the beginning in the school. Because when I do the disease, you're going to see I keep asking about potassium, calcium, and all this business. You're going to be like, well, I didn't do that. Because you did not do electrolytes. Okay? Okay. Vinegar is not good. Vinegar is very salty. It's very, you don't even supposed to take that. A lot of, like, Asian people use alcohol, vinegar. You don't supposed to use that. I don't know that. Sometimes you ever seen somebody say, hey, egg well tea, go drink this herb, and you made that person blood pressure high. Oh my God, I got a headache so bad. You going to jail. You need to stop giving people herbs and telling people egg well tea. Right? No good. Right? Let's go to calcium. Right? If you know calcium, you know phosphorus. You see, that's why all I do with you is potassium high and low, sodium high and low, calcium high and low. Because if you know calcium, you know phosphorus. If you know potassium, you know magnesium. Comprendo? All right. Now, calcium. Let me help you. First, I got to introduce it to you. Calcium is a cool electrolyte. Calcium lives. Where do you live? Some of us live in Miramar. Some of us live in Wellington. Well, calcium lives. Its house is in the bone. In the bone. That's where you're supposed to stay. Now, however, sometimes calcium have a bad day. Leave its house and go to the mall. So calcium will leave the bone and dance its way to the blood. So calcium leave the bone and now go to the blood. So calcium have two problems because you're supposed to be in the bone. When the calcium leaves the bone, the patient at risk for fractures, falls, osteoporosis, right? When it leaves the bone, it goes to the blood. Now the kidney does not work. So when calcium is high in the blood, you got kidney problem. Because not only you have kidney problem, you also have falls because where it's supposed to be, it's no longer. You got it? So let's go. Low calcium, not enough calcium. Now, calcium does not drive by itself. It needs a driver. And the driver is called vitamin D. So, when I take calcium, it will stay here. I need vitamin D to make it dry. Any question? So when a person is low of vitamin D or you low of calcium, you have bone problem, right? So let's go. Long-term immobilization, not moving. Excessive GI losses from diarrhea, wound drainage. End-stage renal disease. Parathyroid problem, yes. Parathyroid problem. The parathyroid job is to produce calcium. So when you have parathyroid, which is here, look, this is your thyroid gland. Next to it, it's its neighbor called parathyroid. So when I do a thyroidectomy and I cut here, which you will learn in endocrine, I mistakenly cut the parathyroid. So I put the patient in low calcium. We will do that in endocrine. Okay? Now, when you take seizure medication, drink a lot of coffee, when you take heparin, a lot of heparin, right? Pancreas problem, Crohn's disease, or when you take too much blood. Too much blood. So who gets a lot of blood? Hemophilia, sickle cell. Not only your calcium is low, but your potassium is what? High. That's where they ask you all that apply. When you give your blood products every day, you have risk for high potassium and low
Calcium.
low calcium. Now, look on your right. You're going to see a little man. I don't know if he's a man and a woman. Somebody tell me what he is. We're going to say a lady. They look like Scooby-Doo, not the dog, but Shaggy. All right, Shaggy. Now, look at that. Anytime, you go to NCLEX and they give you that picture. Oh, you failed the people test. Anytime they give you that picture. Now, let me tell you what they can give you. They can give you the picture and ask you about phosphorus. You passed. That's a level 3. This picture here, it is called the face. Chavastiac. C-H-E or C-H-V. Face. Face equal CHV. C, low calcium. So that means when your calcium is low, I do this to you, you go, right? Low calcium. Or when your calcium is low, I do your blood pressure, your hand go positive Trousseau. Chavastiac. They both is called tetany. Tetany, right? Now, anytime your calcium is low, your phosphorus is high. Anytime your calcium is low, your phosphorus is high. Now, sign and symptom of low calcium: tachycardia, hypotension, paresthesis, cramp, positive Chavastiac, positive Trousseau. Now, high calcium, that means this calcium is in the blood a lot. You will see this patient have a lot of kidney problems. So you will tell me to drink a lot of water. You know why? To wash what? Now, why would you give me allopurinol? Uric acid. See, don't say gout, because this patient doesn't have gout. Uric acid is garbage in the blood. So that is why any time a patient has high calcium, you give them allopurinol to remove the garbage out of the blood, or the patient can go into kidney failure. So let's go. Cause: too much milk, too much antacid, too much vitamin D. Patient who had fractures, osteoporosis. Hey, do you believe I have osteoporosis? When I have osteoporosis, is my calcium high in the blood or low in the blood?
High in the blood.
Because calcium leaves
The bone.
and osteoporosis is low calcium in the bone, so that means all of this calcium is going into the what? Blood. So do you see patient with osteoporosis need dialysis? Yes.
Yeah.
Because calcium leaves the bone and go into the, so they got kidney problem and they got bone problem. Right? And like you see, you have to be fair. Let's no joke. A lot of students, this is their first time learning this. I don't care what they say. first time. And so we gotta be fair that a lot of people didn't get it, right? So we gotta accept that some of us may be a little slow than others, all right? And I can see it by your face. So the people that got it, they give me a look like, I got it. And some people, they don't like it. No, that's not okay, which is okay, right? Now, renal failure, right? We talked about that. Use of lithium. So do you see, this is how complex, and when the patient is on lithium, you gotta initiate safety precaution because lithium causes the calcium, causes osteoporosis. You in trouble. Who did not get that? Anytime a patient is on lithium, the drug lithium depletes the calcium from the bone. So that means the patient got bone problem and the patient have kidney problem. You got that? Okay. Use of steroids. Yeah. Why? Steroids cause low calcium in the what? Bone. So calcium go in the blood. Alcoholism, anytime you drink, you do drugs, it depletes your calcium from the bone. And yes, that's why alcohol patients, you gotta rehydrate them. Yes. Okay, these people, you give a lot of water to what? Wash, flush. Good job. Sign and symptom, increased heart rate, right? Bounding pulse, muscle weakness, diminished deep tendon reflexes, nausea and vomiting, constipation, stomach problem, confusion, lethargy, and coma. Now, the normal calcium, 8.6 to 10. Food high in calcium, cheese, collard greens, milk, soy milk, rhubarb, sardine, spinach, tofu, yogurt. NCLEX question, watch. Which food has the highest source of calcium? The highest. Ready? Yogurt, fish, tuna, yogurt, tuna, green leafy vegetables, and a cake. Which one had the highest? Yeah, so that means highest means all of them are good. See, there you go. Everybody went, if all of them are good, but the key word I said the highest. Now give me the highest. Yogurt. Yes. If I would have said which one is the highest for iron, you would have gave me green leafy vegetable. Milk, cheese is the highest when it comes to calcium. Yes, fish is good, but more sardine high in calcium. Hey, when I say the highest, boy, all of them have calcium, but I say the top notch, it's always milk, cheese, yogurt. Collard greens is there. It has some, but it ain't the highest. Yeah, collard greens have calcium. It ain't the highest. When I say the highest, top. Right? Let me get you again. Which one will be the highest in iron? Highest. Green leafy vegetable, organ meat. So we're going to say liver, chicken, sardine. Which green leafy vegetable? Which one the highest? Green leafy vegetable. There's an understanding, people. All of them have source of iron. But I'm looking for the all right. All right, that is all your electrolytes. Right? So let me recap the pages. You need to read. No. Hold on. Let's go. Page 79, you're going to do box 9-3, cause and sign and symptom for low and high. You're going to do box 9-3, turn that off for me, with the green box. Okay? Then we go to page 80. You're going to do low sodium, high sodium, cause and sign and effect. And then you're going to do box 9-4. Calcium, page 81. You're going to do box table 9-5, cause, sign, and symptom, both. Listen. Miss Sonia said, listen, if you know potassium, you know magnesium. If you know calcium, you know phosphorus. If you want to, did y'all hear that? Because students kind of let it. If you want to, you can read box 9-6 and 9-7. If you want to. How's that? But I said you is a must. You do the potassium high and low, the calcium high and low, sodium high and low. Yes, ma'am. What? Mommy, it's one.
They're all calcium, good for calcium, for calcium. Why is the calcium high and low?
Hey! Huh?
And two full sardines and milk.
Because I said the highest. The highest. Mommy said, oh, what is this? I clearly said highest meat, and I made sure I told you, milk, yogurt, and cheese are the highest in calcium. Yes, spinach has it. Yes, collard greens has it, but you find it more in milk products. That's it. One. And hey, mommy, you know how you gonna get better at this? Question. Look at Dr. Pearson. What I detect, we're not doing enough questions. Question. The jump drive. Question. Evolve. Prep you. Questions. That's how you get better. You can't just read, and don't do questions. All right, take a lunch. See you at 11.